Imagine waking up feeling fine and within hours having the absolute sensation that a truck ran over your body, with a sudden fever and muscle pain that prevents you from even getting out of bed. It's not just a common cold, and curiously, for many people, it's not the virus that has dominated headlines in recent years either. We're talking about an old enemy that has learned new tricks, a variant that caught the world by surprise out of season, and that has gained a mysterious nickname that has left many people confused in emergency rooms. You need to understand exactly what's circulating in the air right now so you don't get caught off guard. Hello, welcome, with as many people as possible so they can stay well informed about this current issue. Let's start by demystifying the name that has generated so much confusion in doctors' offices and on social media. You've probably heard of, or even researched, the so-called K-flu. It's crucial that you understand right from the start that in official medical virology, there is no K classification for influenza. What's happening is a phenomenon of popular communication to describe a very specific variant of the influenza A virus, the H3N2 subtype, Darwin strain. This name, Darwin, comes from the city in Australia where it was first isolated. So when we talk about K-flu here, know that we are scientifically referring to this mutation of H3N2 that has demonstrated a very rapid transmission capacity and more intense symptoms than we were used to in recent flu seasons. The influenza virus is a master of disguise. It undergoes small mutations, called drift antigenic mutations, or like changes in clothing that the body undergoes to avoid being recognized by the antibodies you produced in past flu infections or previous vaccines. This is exactly what makes this current variant so relevant. It has changed enough that our immune system doesn't recognize it immediately, causing this outbreak of cases that we are seeing. Unlike a common cold, which is usually caused by rhinovirus and adenovirus, where you experience a runny nose, a slight headache, and can continue working. Infection with this H3N2 variant knocks the patient down abruptly. It's very important that you know how to differentiate between them at home. In a common cold, the progression is slow and the symptoms are concentrated from the neck up. In this flu, however, the condition is systemic. The virus, upon entering your airways, triggers a very rapid storm of inflammatory cytokines. This is why the cardinal symptom, the one that draws the most attention, is intense myalgia, body aches. Many patients report feeling pain even in the skin, joint pain, and prostration, which is that extreme fatigue where the body immediately demands bed rest. The fever is usually high, often exceeding 38 or 39 degrees Celsius, appearing suddenly, accompanied by chills. Another striking characteristic of this variant is a sore throat, which can be severe, and a dry cough that, if left untreated, develops into a cough with phlegm as the days go by. What we observe clinically is that this H3N2 variant has a predilection for causing more inflammation in the upper airways and bronchi than previous H1N1 strains, for example. This explains the persistent cough that many patients report lasting for weeks, even after the fever subsides. And here comes a crucial point about the timing, that is, the moment when this is happening. We came from a period of intense social isolation, where the use of masks protected us not only from a specific virus, but from all respiratory viruses. This generated what some immunologists call immunological debt. Our immune system became untrained to fight influenza as we went almost 2 years without frequent contact with it. When this Darwin variant arrived, it found fertile ground, people with low specific immunity to influenza and a virus with new mutations. This perfect combination explains why so many people around you, including healthy people, are staying in bed. It's not a reason to panic, but it is a reason for biological respect for the virus. Understanding that when your body is invaded by this strain, it will divert all its metabolic energy to defense is the first step in avoiding mistakes that could worsen the situation. Many people confuse the initial symptoms with allergies or everyday fatigue and continue pushing their routine, going to the gym or to work. And it is at this moment that the virus gains an advantage. Viral replication in the first 48 hours is explosive. If you ignore the sudden fever and body aches, thinking it's just stress, you deny your body the rest it needs to mount its initial defense. The inflammation caused by this H3N2 variant is not just local, it affects the whole body, which is why you lose your appetite and feel that bad taste in your mouth. It's your body saying, stop wasting energy on digestion and focus on the viral battle. Now that you understand how the virus invades and hijacks your body's energy, we need to have a serious conversation about who is on the front line of risk, and more importantly, identify the exact moment when home care is no longer sufficient. The biology of the H3N2 virus has a particularity that differentiates it from other milder seasonal flus. It tends to be more aggressive at the extremes of age, that is, very young children and especially the elderly. The natural aging of our immune system, a process we call immunosenescence in medicine, makes the response of the elderly to the vaccine or the virus itself less efficient. When this variant enters the body of a person over 60 or 65 years old, it doesn't just cause respiratory inflammation. It generates systemic stress that demands a lot from the heart and kidneys. This is why we often see hospitalizations for decompensated diabetes or heart failure that were, in fact, triggered by this flu. The virus was the trigger that pushed a delicate balance to the precipice. For parents and caregivers, extra attention should be paid to children's hydration and persistent fever. Children tend to develop very high fevers with H3N2, which is alarming, but the greatest danger is often rapid dehydration and respiratory distress, which can be mistaken for fatigue. However, there is a pattern of clinical evolution that I want you to memorize, as it is the dividing line between a safe recovery and a serious complication. Normally, an uncomplicated flu has a fever cycle of 3 to 4 days, which subsides with antipyretics. The danger lies in what we call the biphasic curve. Imagine that you or a family member had a high fever, improved on the 4th day, felt well for a day, and suddenly, on the 5th or 6th day, the fever returns with a vengeance, accompanied by shortness of breath or cough with yellowish or greenish phlegm. This is not the virus returning. This is almost always a sign of secondary bacterial pneumonia. The flu virus destroys the first protective layer of our lungs, the cilia that sweep away impurities, leaving the door open for opportunistic bacteria to enter and cause a serious infection. This is the critical moment when you shouldn't wait at home, as the treatment changes completely and may require antibiotics, not just antivirals. Knowing when to seek emergency care is a concern that worries many people and unnecessarily overcrowds hospitals, exposing you to more viruses. If you are a healthy young adult without chronic illnesses and have a controllable fever, body aches, and a runny nose, the ideal is complete rest and vigorous hydration at home. The emergency room should be reserved for clear warning signs. The first and most urgent is dyspnea, which is shortness of breath or the feeling that you cannot fill your chest completely. Another sign, especially in the elderly, is mental confusion or excessive drowsiness. If the elderly person stops interacting, becomes very quiet, or speaks incoherently, this may be a sign of low oxygenation, even if they do not complain of shortness of breath. Persistent chest pain and low blood pressure are also indicators that the body is not coping with the metabolic demands of the infection. In these cases, immediate medical evaluation is non-negotiable. Another point that generates a lot of confusion is how this variant spreads. The transmissibility of the Darwin strain of H3N2 has proven extremely effective. Transmission occurs mainly through droplets that we expel when speaking, coughing, or sneezing, but also through aerosols that remain suspended in the air in closed and poorly ventilated environments. What makes control difficult is that an infected person can start transmitting the virus a day before they begin to have symptoms. That is, you could be at a family lunch feeling great and already be passing the virus on to your parents or grandparents. The incubation period is short, usually 1 to 4 days, which explains why entire families fall ill almost simultaneously. The viral load is very high in the first 48 to 72 hours of symptoms, which is precisely when the person feels worst. It is also crucial to address the issue of differential diagnosis. Today, we live in a scenario where influenza, coronavirus, and respiratory syncytial virus circulate simultaneously. Clinically, just by looking at the patient, it is very difficult for us doctors to distinguish with 100% certainty which virus it is, as the symptoms overlap significantly. Loss of smell and taste, which was classic in COVID-19, is less common with the new variants of coronavirus and rare in influenza, but fever and body aches are identical. Therefore, if you are part of a risk group, the rapid test or viral panel is not just a curiosity, it is a therapeutic decision tool. Knowing if it is influenza within the first 48 hours changes the game, because for influenza, we have specific antivirals that work very well if started early, drastically reducing the chance of hospitalization and death. If we let this window of opportunity pass thinking it's just any old virus, we lose the chance to block viral replication before it causes extensive damage. Continuing our reasoning about the window of opportunity for treatment, it is vital to demystify the use of antiviral medications, specifically oseltamivir phosphate, popularly known by its brand names. Many people believe that there is a cure-all for the flu that should be taken by anyone as soon as their nose starts to run, but evidence-based medicine is very careful about this. The antiviral works by inhibiting an enzyme on the surface of the virus, neuraminidase, which is the tool the virus uses to break free from the infected cell and invade the next one. If we block this enzyme within the first 48 hours, we prevent the viral load from exploding. However, if we go beyond this period, the virus has already spread so much that the medication loses almost all its effectiveness. In addition, this medication is not without side effects. It can cause intense nausea, vomiting, and in rare cases, neuropsychiatric changes. It is because of this risk-benefit balance that we, as doctors, generally reserve prescriptions for the elderly, pregnant women, immunocompromised individuals, and people with serious chronic illnesses. For a healthy young person, the immune system itself can handle the situation without needing to expose the body to the adverse effects of the drug. This brings us to the cornerstone of treatment for the vast majority of people: symptomatic support and hydration. It seems like overly simplistic advice: drink water, but in the context of the H3N2 variant, water is the best expectorant there is. The mucus produced in this flu tends to be thick, and if you are dehydrated by fever, this mucus becomes a perfect culture medium for bacteria in the lungs. Maintaining clear urine is a sign that your mucous membranes are hydrated enough to expel the virus. As for over-the-counter pain and fever medications, such as dipyrone and paracetamol, they are excellent allies for maintaining comfort, but there's a giant red alert here. Never use acetylsalicylic acid, ASA, in children or adolescents suspected of having the flu. The combination of the influenza virus with ASA can trigger a very rare and fatal condition called Ray's syndrome, which causes brain swelling and fulminant liver damage. It's an old risk that medicine knows about, but that many parents forget when self-medicating. Another classic mistake we need to combat is the indiscriminate use of antibiotics. I see this every day. A patient has had a high fever for 2 days, gets anxious, and takes an antibiotic, like azithromycin or amoxicillin, on their own, or orders it from the pharmacy. Understand this once and for all. Antibiotics kill bacteria. They don't even tickle the flu virus. Taking antibiotics for a purely viral infection not only doesn't help, but it destroys your gut flora, which is an essential part of your immunity, and creates super-resistant bacteria in your body. Antibiotics should only be used if, and only if, there is that secondary bacterial complication we discussed earlier, diagnosed by a doctor. The anxiety to do something to cure it quickly is what often leads to complications from drug poisoning. Looking to the future and to prevention, vaccination remains our most sophisticated technology, but we need to align expectations. The flu vaccine is not an impenetrable force field that prevents the virus from entering your nose. It is, in fact, training for your defense army. It teaches your body to recognize the enemy so that when the real virus arrives, the response is quick enough to prevent it from destroying your lungs. That's why someone who is vaccinated can still get the flu, but this flu tends to be mild, like a common cold, and not that devastating illness that leads to intubation. Vaccines are updated annually based on the strains that circulated most in the opposite hemisphere the previous winter. Therefore, getting vaccinated every year is not fastidiousness, it's a biological necessity, because the virus changes its face each season, and antibody protection decreases after a few months. The vaccine we have today already covers the H3N2 variants, offering important cross-protection against severe cases. In addition to the vaccine, the respiratory etiquette we've learned in recent years needs to be maintained. If you have symptoms, wearing a mask is not shameful. It's an act of respect and love for others. You break the chain of transmission. Ventilating rooms is another powerful measure. The influenza virus doesn't like circulating air and sunlight. It prefers closed and dry places. Keeping windows open dilutes the viral load in the environment, reducing the chance of intrafamily contagion. And of course, hand washing, as we frequently touch contaminated surfaces and then touch our eyes or mouth. Before closing, I saved a golden tip. For you, something I practice daily and recommend to all my patients, but that few people give the importance it deserves. Many people only focus on taking medication after the virus has already taken hold, but there is a mechanical secret weapon to reduce the aggressiveness of this flu nasal irrigation with saline solution. Understand the logic. The H3N2 virus begins to replicate, that is, to multiply, in the mucous membranes of your nose and throat. When you perform nasal irrigation with saline solution at least twice a day, you do two incredible things. First, you physically sweep part of this viral load out, reducing the number of enemies your body needs to fight. Second, and most importantly, you hydrate the cilia in your nose. Remember I said they are the defense's little brooms? Dry cilia don't work. Cilia hydrated with saline solution work at full speed to expel the virus and prevent it from descending into the lungs and causing pneumonia. So don't wait for your nose to get stuffy. Have you started feeling that scratchy feeling in your throat, or have you been in contact with someone who has a cold? Use saline solution in your nose. It's cheap, simple, and could be the detail that transforms a bad cold into just a mild discomfort. QI want you to leave here with the message that the H3N2 variant, or K-flu as it became popularly known, demands respect, but not panic. Panic paralyzes, knowledge protects. Monitor symptoms, hydrate aggressively, protect the elderly and children, and know the exact time to seek medical help if you experience shortness of breath or persistent fever. The human body is an incredible healing machine when we give it the right conditions to work. Don't look for shortcuts with miracle drugs from the internet. Trust in biology, rest, and evidence-based medical science. I'm Dr. Robert Torniere, and I hope this information has brought clarity and peace of mind to help you deal with this moment. Take good care of yourself, take care of your loved ones, and we'll see each other again with better health and prevention. Until next time.